Assalamu alaikum doctors. Today our topic of discussion is on dysmenorrhea. So whenever you come across a word with a dys, it stands for the painful, while menorrhea stands for the menstruation. So dysmenorrhea consists of two words, that is dys, which means painful, and menorrhea means menstruation. So what is dysmenorrhea? It is the painful menstruation. It is the painful menstrual periods. Now, there is a question how you will differentiate the pain of dysmenorrhea with date of pain of endometriosis. So, pain of dysmenorrhea, it occurs usually at the time of menstruation, or it occurs 1 to 2 days after menstruation, while pain of endometriosis, it usually occurs 1 to 2 days before the menstruation. So, it is important. There is how you will differentiate the pain of dysmenorrhea with date of pain of endometriosis. So, pain of dysmenorrhea, it occurs usually at the time of menstruation. At the time of menstruation, or 1 to 2 days after menstruation, while pain of endometriosis, it usually occurs 1 to 2 days before menstruation. Now, there is another question, what is the pattern of the pain and dysmenorrhea? So usually in dysmenorrhea there is lower crampy abdominal pain. In dysmenorrhea there is crampy lower abdominal pain at time of menstruation, or 1 to 2 days after menstruation. So what is the nature of pain of dysmenorrhea? In dysmenorrhea there is crampy lower abdominal pain, and from the lower abdominal area the pain is radiated from lower abdominal area. The pain is radiated to the lower back area, and often it radiates to the lower extremities. So in dysmenorrhea there is crampy lower abdominal pain, and from lower abdominal area the pain is radiated to the lower back area, and ultimately it involves the lower extremities. So this is important. Now, how the patient of dysmenorrhea usually presented? So the patient of dysmenorrhea usually presented with the gastrointestinal manifestation, cardiovascular manifestation, and neurological manifestation. Also, it is associated with the general malaise. So student, this is just an overview of the dysmenorrhea. So dysmenorrhea is the painful menstrual periods, and in dysmenorrhea there is crampy lower abdominal pain, and from lower abdominal area it radiates to the lower back area, and then it involves the lower extremities. So student, this is all about the general overview of the dysmenorrhea. Now let's discuss the types of dysmenorrhea. So there are two types of dysmenorrhea. So dysmenorrhea is broadly classified into two types, that is primary dysmenorrhea and secondary dysmenorrhea. Now primary dysmenorrhea, it is more common in the young girls, while secondary dysmenorrhea, it is more common in the older ladies. So primary dysmenorrhea is more common in the teen girls, while secondary dysmenorrhea, it is more common in the older ladies. Now in primary dysmenorrhea there is crampy lower abdominal pain, and actually in the period at the time of menstruation or 1 to 2 days after menstruation, and the absence of any pathological pelvic disease. So in primary dysmenorrhea there is crampy lower abdominal pain. There is crampy lower abdominal pain at time of menstruation or 1 to 2 days after menstruation, in the absence of any pathological pelvic diseases like uterine fibroids, uterine polyps, or endometritis. So in primary dysmenorrhea there is crampy lower abdominal pain at the time of menstruation or 1 to 2 days after menstruation, and the most important point is that it is not associated with the underlying pathology. So here the crampy lower abdominal pain is there and the absence of any pathological pelvic disease. It means it is not associated with the underlying pathology. So please pay attention to this point. It is a very important point that it is not associated with the underlying pathologies like uterine fibroids, uterine polyps, and endometritis. While in another hand, secondary dysmenorrhea, it is associated with the underlying pathologies. It is associated with underlying pathologies, and it is more common in the older ladies. So students, that's all about the primary dysmenorrhea and secondary dysmenorrhea definition. Now let's discuss the primary dysmenorrhea in a detail. Now we discussed that primary dysmenorrhea there is crampy lower abdominal pain and the absence of any pathological pelvic diseases. It means they are not associated with the underlying pathologies. Now, what are the risk factors for primary dysmenorrhea? So, the risk factor for the primary dysmenorrhea, that is early age at menarche and prolonged menstruation. Also there is obesity, cigarette smoking, and alcohol consumption. So what are the risk factors for the primary dysmenorrhea? That is early age at menarche, that is round about less than 12 years, and prolonged menstruation, obesity, cigarette smoking, and alcohol consumption. So that's all about the risk factor for the primary dysmenorrhea. Now let's discuss the causes of primary dysmenorrhea. Now what are the causes of primary dysmenorrhea? Now the exact cause for the primary dysmenorrhea, it is unknown. So we can say that it is usually idiopathic. It is usually idiopathic. The cause is unknown, but yes, there are certain theories are put forward in order to explain the certain reason for the primary dysmenorrhea. So there are certain theories which suggest the possible reason for the primary dysmenorrhea. What are those causes? So the first cause for the primary dysmenorrhea, that is considered as a increased uterine myometrial contractility. So as you know that uterus consists of three layers: outer layer, middle layer and inner layer. So outer layer is called perimetrium, middle layer is called myometrium, while inner layer is called endometrium. So the major cause for the primary dysmenorrhea, that is increased uterine myometrial contractility. Whenever there is a uterine hyperactivity, so in that condition the middle layer of the uterus, their contractility is increased further. So as a result of that, there is pain felt by a patient during the menstruation. So it is also considered one of the cause for the primary dysmenorrhea. Now the second cause for the primary dysmenorrhea, that is decreased uterine blood flow. Decreased uterine blood flow. So when blood flow is decreased to the uterus, majorly when blood flow decreases to the endometrium and myometrium, so what happens in that condition, there is ischemia occur. So that ischemia also lead to the pain during the menstruation in the patients. Now the third cause for primary dysmenorrhea that is reported, that is septate uterus. That is septate uterus. Now as you know that, let's suppose this is a uterus. So already we discussed that uterus consists of the three layers, uterus consists of three parts, that is fundus, body and cervix. So as you know that uterus consists of three parts, that is fundus of the uterus, this whole it is considered as the body of the uterus, while that is the neck of uterus, which is also called cervix. Now in septate uterus, there is septa or membrane is formed in the mid area of the body of the uterus. So please pay attention to the point. In septate uterus, there is the formation of septa or membrane, but that septa or membrane, it is formed in the body of the uterus. It is not lying within the fundus of the uterus, it is not lying within the cervix of the cervix and neck of uterus. So in septate uterus, there is septa is formed in the mid of the body of the uterus. So this septa, which is also called membrane, it could be thin or thick, and actually it is a fibrous and muscular band of tissues. So as a result of this septate formation, it divides the single compartment body of uterus into double compartment parts of the uterus. So this septa, it is formed as a result of congenital anomaly. It is formed because of congenital anomaly, and majorly that is because of the defects in the Mullerian duct. Now as you know that whenever female conceive the pregnancy, so there is formation of the reproductive organ in the fetus. So that formation of reproductive organs in the fetus, that is due to the Mullerian duct and Wolferian duct. Now if fetus is female, so in that condition the Mullerian duct is persist, but Wolferian duct it get disappear, and if the fetus is male, so in that condition the Mullerian duct is disappear and the Wolferian duct is persist. As you know that the Mullerian duct it helps in the development of the female reproductive system, while the Wolferian duct it helps in the development of the male reproductive system. Now if the fetus is female, so in that condition the Mullerian duct is persist, but the Wolferian duct with the passage of time it get disappear. And as you know that Mullerian duct it forms the female reproductive system, and the female reproductive system it usually forms the fallopian tube, it forms the uterus, and it forms the upper half of vagina, while the lower part of vagina it is derived from the urogenital sinuses. So Mullerian duct form the fallopian tube, uterus, upper part of the vagina. So if there is congenital anomaly occur in Mullerian duct, so there is formation of the female reproductive system will be disrupted. So if there is congenital anomaly in the Mullerian duct, so as a result of that, there is septa formation occur in the body of the uterus, and ultimately it divides the one compartment into double compartment. So that's all about the septate uterus, and how you would treat the septate uterus condition. You have to treat the septate uterus by surgical approach. So now the another cause of the primary dysmenorrhea, that is called as bicurvate uterus. Now bicurvate uterus, it is also considered as a congenital anomaly of the Mullerian duct, and here the uterus shape is disturbed. The normal shape of uterus is being disturbed, and the uterus, in this condition, the uterus is become heart shape. The uterus is become heart shape. And this condition in bicurvate uterus, as we know that the uterus consists of three parts: fundus, body and cervix. So in the bicurvate uterus, the fundus, that area, they are absent. Now their formation is absent in the condition of bicurvate uterus. So as a result of this, the uterus is look like as heart shape. So it is also considered as a cause of the primary dysmenorrhea. Now what is the another cause for the primary dysmenorrhea? The another cause for the primary dysmenorrhea that is being reported, that is uterine hypoplasia. That is uterine hypoplasia, which means there is incomplete development of the tissue. Hypoplasia means that there is decreased number of cell proliferation. So if there is decreased number of cell proliferation, so the estrogen and progesterone level is get imbalanced. So as a result of that, there is menstrual abnormality occur, and often female feel with a pain during menstruation. So it is also considered as a one cause for the primary dysmenorrhea. Now the another cause for the primary dysmenorrhea, that is called as cervical congestion, which is also called cervical stenosis or cervical vein incompetence. Now here what happens, that the cervical vein, it become thick and twist. Let's suppose if this is a cervical vein, so this cervical vein, it become thick and it become twist. So as a result of that, the menstrual blood is not move properly, so there is obstruction occur to the menstrual blood flow. So as a result of that, the endometrial layer is also become thick, and also in this condition the female offer with the pain during the menstruation. Now what is the another cause for the primary dysmenorrhea? That is the increased level of ADH. Now ADH is also called as a vasopressin, and as you know that ADH, that is antidiuretic hormone, it is considered as a powerful stimulant for the non-pregnant uterus. So it is a powerful stimulant for non-pregnant uterus. Now let's suppose if the ADH level is increased from the normal level, if ADH level raised from the normal value during menstruation, so what happens? During menstruation, when ADH level raised from the normal value, so it directly affect the myometrium layer. It directly affect the myometrial layer, which is the middle layer of the uterus. So as a result of that, there is hypersensitization occur. Hypersensitization of myometrium occur. So whenever there is hypersensitization occur to the myometrium layer, so the pressure on blood vessels or the pressure on the myometrium, it is increased from the normal value, so there is vasoconstriction occur, and the blood flow, as a result of this, the uterine blood flow is decreased from the normal value. So it often lead to the pain during menstruation as well. So it is also considered as the most important cause for the primary dysmenorrhea. While another cause for the primary dysmenorrhea, that is increased level of progesterone. Sorry, the increased level of the prostaglandins. So the another cause is increased level of the prostaglandins. It is also considered the most important cause for the primary dysmenorrhea, and this condition, the chemical prostaglandin, it controls the contraction of the uterus. Always remember the point that the chemical prostaglandin, it controls the uterine contraction. It causes muscles to contract well of the uterine layer. Now there are two important prostaglandins, that is called as PGE2 and PGF2 alpha. Now these two prostaglandins are more associated to cause the primary dysmenorrhea. This PGE2, it is actually a vasoconstrictor. It is a vasoconstrictor, and it is also the powerful stimulant of myometrium contractility. While PGE2, it increases the sensitization of nerve ending to other pain producing substance. So, in PGE2, it increases the sensitization of nerve ending to other pain-producing substance, while PGF2 alpha, it is a vasoconstrictor and it is a powerful stimulant of the myometrium contractility. So, if there is increased level of the prostaglandin, so as a result of that, there is a strong vasoconstriction occur in the myometrium layer or in the uterine layer. So, as a result of that, there is also decreased uterine blood flow and there is formation of blood clot occur, which often lead to the pain during menstruation. Now the another cause, that is anxiety. So students, that's all about the major causes for the primary dysmenorrhea. So it is worth noting what are the causes for the primary dysmenorrhea. Though the cause of primary dysmenorrhea is unknown, it is usually idiopathic. But yes, there are certain theories put forward in order to explain the possible reason for the primary dysmenorrhea. So the first is increased uterine myometrium contractility. The second cause that is reported, that is decreased uterine blood flow. The third is septate uterus, and the fourth cause of primary dysmenorrhea, that is bicornuate uterus, while the fifth cause is uterine hyperplasia, while the sixth cause is cervical congestion, which is also called cervical stenosis or cervical vein incompetence, and the other cause is increased level of ADH and increased level of the prostaglandins and anxiety. Now there is an important question that which one of the following is the most common and important cause for the primary dysmenorrhea? So the answer to the question is, that is the increased level of the ADH and increased level of the prostaglandin. It is considered as the most important and common cause for the primary dysmenorrhea. So students, that's all about the causes of primary dysmenorrhea. Now let's switch toward the sign and symptoms of the primary dysmenorrhea. What are the signs and symptoms for the primary dysmenorrhea? So already we discussed in primary dysmenorrhea there is crampy lower abdominal pain. So what are the signs and symptoms? Sign and symptoms for primary dysmenorrhea. So the signs and symptoms are, there is cramps in lower abdomen, there is pain in lower abdomen, and from the lower abdominal area, from lower abdominal area, the pain is radiated to the lower back, and ultimately it involves the lower extremities. Also, the patient usually manifested with the nausea and vomiting. It is also associated with the diarrhea, and there is the general malaise symptoms as well. There is weakness to the patients, there is fatigue to the patients, and there is fainting. So what are the main signs and symptoms for the primary dysmenorrhea? That is cramps and lower abdomen. There is pain in the lower abdominal area. From the lower abdominal area, the pain is radiated to the lower back, and then it involves the lower extremities. There is nausea and vomiting and diarrhea and weakness and fainting to the patient. So that's are the sign and symptom for the primary dysmenorrhea. Now, how you would treat the patient of the primary dysmenorrhea? Now, usually these signs and symptoms, it is resolved within 2 to 3 days. What are the treatment option for primary dysmenorrhea? Now, usually these signs and symptoms that we discussed earlier, that is cramps in the lower abdomen, that is the pain in lower abdomen, and also nausea, vomiting, fatigue, and fainting. So these are all signs and symptoms. Usually it resolves within the 2 to 3 days. These signs and symptoms resolve within 2 to 3 days often. So in that condition, no treatment is given. But if the condition is severe, then you have to treat the patients. So in that condition, you would treat the patient either by medical approach or by surgical approach. Now, but it depends upon the cause. So in the medical treatment, you have an option for the prostaglandin synthetase inhibitors. The first choice for the medical treatment, that is prostaglandin synthetase inhibitors. Usually it interferes with the prostaglandins for the PGE2, more specifically for the PGE2 and PGF2 alpha. So the prostaglandin synthetase inhibitor, it usually interferes with the prostaglandin and it decreases the prostaglandin synthesis. So the first treatment option is prostaglandin synthetase inhibitors. It usually involves the NSAIDs, that is non-steroidal anti-inflammatory drugs. So in the NSAIDs, we have to give the patients, that is mefenamic acid. Also, we have to give ibuprofen and indomethacin. Now, it is given in 250 mg. It is also given in 250 mg, while ibuprofen, it is given in a 400 mg dose. And these all are for the 3 days, that is 3 days. Now, the first option is prostaglandin synthetase inhibitors. Usually you have to give the patient NSAIDs, that is non-steroidal anti-inflammatory drugs. Out of NSAIDs, you have to give mefenamic acid to the patient. You have an approach of ibuprofen and indomethacin as well. While the dose for the mefenamic acid and indomethacin is same, that is 250 mg, while for the ibuprofen, that is 400 mg, and it is usually recommended for the 3 days. Now, the another option is combined oral contraceptive pills. Now, actually, it relieves the symptoms by causing an ovulation. So you have to give combined oral contraceptive pills as well. While the other option, that is calcium channel blockers. Out of calcium channel blockers, you have to give nifedipine. Nifedipine is the drug of choice and the calcium channel blockers, and usually what it do, that it decrease the uterine myometrial contractility. So you have to go calcium channel blocker as well. The drug of choice for the calcium channel blocker, that is nifedipine, which cause decreased uterine myometrium contractility. The another option is beta receptor stimulant. It is beta receptor stimulant. Out of beta receptor stimulant, you have to give terbutaline. It is terbutaline. And actually what terbutaline do, it increase the uterine blood flow. So these all are medical approach to the patients. So out of medical treatment, you have to go prostaglandin synthase inhibitors, combined oral contraceptive pills, calcium channel blockers, and beta receptor stimulant. While in another condition, there is surgical treatment as well. If patient is unable to treat from the medical treatment, then you have to select the surgical approach. But it also depending upon the cause as well. So let's suppose if the patient has a cervical stenosis, so in that condition you would do dilatation and curettage. So while the another approach is presacral neurectomy. Actually, what we do in presacral neurectomy, it relieves the pain by interrupting the nerve supply to the uterus. It relieves the pain by interrupting nerve supply to the uterus. Now, it is worth noting what is the treatment for the primary dysmenorrhea. It is classified into medical treatment and surgical treatment. In the medical treatment, we have an option of prostaglandin synthase inhibitors, combined oral contraceptive pills, calcium channel blockers, beta receptor stimulants. While for the surgical approach, we have to do dilatation and curettage. Also, we have an option for the presacral neurectomy. So, students, that's all about the first type of dysmenorrhea, that is called as primary dysmenorrhea. Now let's talk about the another type of dysmenorrhea, that is referred as a secondary dysmenorrhea. Now what is secondary dysmenorrhea? In secondary dysmenorrhia, there is crampy lower abdominal pain during menstruation or 1 to 2 days after menstruation, and the presence of pathological pelvic disease. So it is very important point that it is associated with the underlying pathologies. So the another option is the another type for the dysmenorrhea, that is secondary dysmenorrhea. So this secondary dysmenorrhea, it is associated with the underlying pathology. It is associated with underlying pathologies, and secondary dysmenorrhea, it is more common in older females. Now the another point is, what are the major causes for the secondary dysmenorrhea? So the causes of secondary dysmenorrhea is classified into two groups, that is congenital causes and acquired causes. So in the congenital causes, there are different organs like in vagina, hymen, cervix, and uterus. So in the vagina, there is a condition that is called transvaginal septums. So it is a wall of tissue that is running across the vagina, and it blocks usually the vagina. So the condition that is called transvaginal septum, it is one of the cause for the secondary dysmenorrhea. Now what is the another cause for the secondary dysmenorrhea? That is imperforate hymen. That is imperforate hymen. And the cervix, there is cervical stenosis. And the uterus, there is rudimentary uterine horn. So what are the congenital causes for the secondary dysmenorrhea? That is transvaginal septum, imperforate hymen, cervical stenosis, rudimentary uterine horn. While transvaginal septum, it is treated upon by looking the cause for it. While imperforate hymen, it is treated with the transvaginal septum is treated by looking for cause. While imperforate hymen, it is treated with the incision. The treatment is incision. While for the cervical stenosis, there is dilatation in curettage. While for the rudimentary uterine horn, the option of treatment is excision. So that's all about the congenital causes for the secondary dysmenorrhea. What are the acquired causes for the secondary dysmenorrhea? So the acquired causes is further classified into 3 groups. That is, within the uterine lumen, the causes of secondary dysmenorrhea which are associated within the uterine lumen, within uterine wall, and outside the certain conditions which are associated outside the uterus, which are concerned with the secondary dysmenorrhea. So within uterine lumen, the condition are, that is, endometrial polyps and intrauterine contraceptive devices. So endometrial polyps and intrauterine contraceptive devices, it is the acquired cause for the secondary dysmenorrhea. Often the endometrial polyp, it is treated with polypectomy, while intrauterine contraceptive devices is treated by removal of intrauterine contraceptive devices. While for there are certain conditions which is lying within the uterine wall, that is endometrial fibroids and adenomyosis. So adenomyosis is treated with levonorgestrel, and endometrial fibroid, it is treated with hysterectomy. While there are certain conditions that are lying outside the uterus, like endometriosis, that is endometriosis, pelvic inflammatory diseases, and also it consists of pelvic adhesion. So endometriosis, it is usually treated with the danazol, and for the pelvic inflammatory diseases there are various antibiotics is recommended, while for the pelvic adhesion there is adhesolysis. So students, that's all are the major causes for the secondary dysmenorrhea, that is congenital causes and acquired causes. Now if you can't remember the causes of secondary dysmenorrhea in this pattern, so you can learn the causes of secondary dysmenorrhea by a mnemonic that is called as FACE. So this is a simple trick to learn the major and main causes for the secondary dysmenorrhea. So from the FACE, each alphabet will correspond to the one of the conditions which are associated with the secondary dysmenorrhea. While F stands for the fibroids, A stands for adenomyosis, C stands for cervical stenosis, while E stands for endometriosis. So what are the major causes for the secondary dysmenorrhea? That is fibroids, adenomyosis, cervical stenosis, and endometriosis. So there is another question, that what is the most common cause for the secondary dysmenorrhea? So answer to the question is, that is endometriosis. So endometriosis is the most common cause for secondary dysmenorrhea. So student, that's all about the causes for the secondary dysmenorrhea. Now let's discuss the diagnosis of the secondary dysmenorrhea, how you would diagnose the patient with a secondary dysmenorrhea. So let's discuss the diagnosis of secondary dysmenorrhea. So in order to diagnose the secondary dysmenorrhea, there is a trick for it, that is wet HBL. So just learn the trick for the diagnosis, that is wet HBL, where every single alphabet will show us one of the diagnostic criteria for the secondary dysmenorrhea. So where V stand for the vaginal swab and E stand for endocervical swab. So vaginal swab and endocervical swab, it is done in order to see the infection for the genital area, in order to see infection in genital area. So that is vaginal swab and endocervical swab. The another diagnostic criteria is transvaginal ultrasound. Transvaginal ultrasound. If there is suspicions of the endometriosis or adenomyosis, then we have to do transvaginal ultrasound. If there is suspicion of the endometriosis and the adenomyosis. While the another approach is hysteroscopy. Here we visualize the uterus, and B stand for the blood test. We mostly do the CBC, which is also called FBC, complete blood count, half blood count, and also we go for laparoscopy. So this is a short diagnosis for the secondary dysmenorrhea, that is vaginal swab, endocervical swab, transvaginal ultrasound, hysteroscopy, blood test, and laparoscopy. So how you would treat the patient with a secondary dysmenorrhea? So often it is usually associated with the cause. You have to treat the cause, but usually the patient is given by NSAIDs in the form of mefenamic acid or endomethacin. So student, that's all about the dysmenorrhea. We discussed the primary dysmenorrhea and secondary dysmenorrhea. We hope that our lecture will help you a lot. Thank you so much.